Today's Community Spotlight. I am super excited to feature the St. Alphonsus Community Health Worker Program, and this is brought to us by Glenda Gonzalez. Glenda is the supervisor of the Community Health and Wellbeing Department for St. Alphonsus Health System, and she's spent the majority of her 8 years of her career with the St. Alphonsus, developing and growing the Community Health Worker Program. Glenda moved to Boise from Wenatchee, Washington to pursue her bachelor's degree in health sciences from Boise State University. She's passionate about advancing community health workers across Idaho and enjoys helping her community by volunteering and serving on various committees and boards. And in her spare time, she enjoys spending time with family and friends, hiking with her 2 dogs, Milo and Jazzy, and trying different restaurants in the Treasure Valley. And one thing I will say is her passion is demonstrated and just shines through. I've met Glenda both in person at different events and then also some different collaborations or alliance type meetings. And she is incredibly passionate about the work that she does. So thank you, Glenda, for sharing your time and your expertise with us. And I'm going to turn it over to you who share information about the St. Alphonsus Community Health Worker Program.
Thank you. Let me go ahead and get my slides. Let me share my screen.
Okay. And we have your presentation. If you are having any kind of technical difficulties, we can pop it up. All right, it's up.
Making sure to do the section. Okay. Okay, are you able to see it?
We are, Glenda, yes.
Oh, perfect. And I'm not able to see the chat, so if anybody
I can monitor
okay.
that for you.
Perfect. Well, thank you for having me this morning. My name is Glenda Gonzalez. I'm the supervisor for community health and wellbeing. I've been at St. Al's for 8 years now in various different roles, but in my current role, it's going to be 4 years. So I was kind of tasked to help build our community health worker program at St. Al's. So our community health and wellbeing department kind of was tasked to build our community health worker program in May 2020, kind of around COVID time. So our community health worker program kind of helps address patients' social needs and promotes healthy behaviors by facilitating connections between healthcare and community partners. So this picture kind of gives a good example of what our community health workers do and kind of help connect our individual either patient or community member with various different resources within the community. So with our community health workers, we do community partnerships, community patient outreach and advocacy. We also work with a lot of community partners with resource navigation. We just started probably in 2021, we got a new electronic health system called Epic. It's similar to St. Luke's. So we're able to kind of help coordinate care. We also have, it's called the Community Resource Directory, which many of you all know as findhelpidaho.org, to be able to help find resources within the community. What is a community health worker? So a community health worker is someone that is a public health worker, is trusted member of the community, kind of understands the community that we serve, and is that kind of trusted member to bridge the gap between healthcare and social services. So we help kind of facilitate care and improve the quality of the care that we provide, and as well as connect patients and community members to different resources. So kind of the functions of our community health workers are, one of the most important things is we can do home visits and community visits. So we go out to the community and meet them where they're at to help identify any social needs or barriers to their care. So sometimes we get individuals that are homebound and they're not able to access the care that they need. So we can go to their home and visit them, or they just feel more comfortable in their home, in their space, than coming to a hospital system to be able to get some care. We also provide social and emotional support. We help advocate for our individuals and as well as out in the community, so community health needs. And we also assist our patients in enrolling into different social service programs. So this could be help with housing, help with transportation, food access, social isolation, just getting people connected to the right resources and making sure that they get connected to those resources. One thing with the community health workers, we are non-clinical, so we are not social workers, we're not nurses. We're just people that are really interested in helping the community in any way that we can. But we do work closely with clinicians and care teams. So we work with primary care doctors, we work with nurse care managers, social workers, case managers. We like to collaborate with whoever we can to best serve the patients that we work with. So we help empower and assist and direct patients to resources. And then a little up here, we do also have our mobile health clinic. So we provide free medical services out to the community. All our services are free, and we also have community health workers that they can meet with to help find different resources. So right now in the winter time, we are not operationalized, but we'll be starting back up in the springtime. And we got a new vehicle that will be starting in Ontario, Oregon as well. And then hopefully in the future in Baker City, Oregon. And then during COVID, back in 2020 to like kind of 2022, we were doing mobile COVID vaccines out in the community. So this picture below, we were out at Corpus Christi, the day shelter in Boise, providing free COVID vaccines. So we did that a lot from 2020 to 2022, going out to various community partners, churches, schools, and providing free COVID vaccines. And we also helped do in-home vaccination. So we went out to community members' homes that weren't able to go to pharmacies or go to locations like this because they're more homebound. So we did go and provide in-home vaccinations to those individuals that needed it, and flu vaccines as well. So this is kind of the services that we provide. So connection to behavioral health services. We can't do any assessments or anything like that, but if the individual is interested in going to counseling or getting treatment, we can help them find a free or reduced cost services. We also help with benefit enrollment. So if somebody is interested in applying for Medicaid, for SNAP, any type of insurance, we can help with that. Help them guide to the filling out applications and stuff like that. We also help with financial assistance. If that's with St. Alphonsus, we can help them apply for St. Alphonsus financial assistance and various other financial assistance applications. Food resources and food access. So helping them find different food pantries, different food education. We also help with primary care, so helping them get connected to primary care doctors, either if they're uninsured or in the Medicaid population, so helping them get connected to those safety net health centers or FQHCs if they are unable to afford because they can't get insurance, so we help them find different community health centers. Low or no cost medications, so sometimes individuals have medications that cost a lot of money, so we help find some financial assistance through some pharmacy companies. So we help them fill out applications and stuff like that to get lower cost medications or even free medications. We also help with getting people connected to housing or shelter. So if people are getting evicted or need help with utilities or back rent, we can help them get connected with different resources. As mentioned below, social isolation programs, connection to tobacco cessation. We do have a tobacco cessation nurse on our team that's able to help do group classes, one-on-one education, and it's also a free service. And then as well, transportation assistance to medical visits or other social support, going to the grocery store, going to the senior center, various different things. We can help assist with those. And then among many other things, there's always something that we learn, something new that our community health workers are helping out with. Who the ideal candidate for our program is any patient or community member that has barriers to accessing care, needing assistance with community resources, any social service navigation, needing help with social influencers of health, so like food, housing, transportation, any of those type of social needs, and then they must be willing to engage with our community health workers. So we want to be able to empower them to be able to do it themselves, so that we're not always going to be there to be able to provide these resources or help them with um, filling out applications and stuff, but we want to make sure that we empower them to be able to do it for themselves in the future. And then how to refer to our program. So there are two different ways that you can refer to our program. The first one is through findhelpidaho.org. Our program is on that website. So you can see down here, this is kind of how it looks on our website. You can fill in the information. And then our only ask is in the comment section, if you can add the date of birth or anything that you want our CHW team to know. And then I receive those, and then I assign them to our community health workers, and then we'll outreach to the patient within 24 to 48 hours. The next one is we do have a CHW hotline, and the numbers on there. We're available from Monday through Friday from 8 to 5, and that's Mountain Time. And then you can get connected to a community health worker. So we have community health workers from Boise, Idaho, all the way to Baker City, Oregon. And that number gets them connected to a community health worker that can help them find different resources within the community. And then these are some of the flyers that we have, and I'm open to sending these out to anybody that needs them, so you can have them for your community members. So these are flyers that we have, and then business cards. And then this little QR code goes to the findhelpidaho.org website, so people can scan it and find resources on their own. But they can definitely give us a call if they need any assistance. The program is free. They don't have to be St. Alphonsus patients. Anybody can call our hotline. And then I want to talk a little bit about the social needs screenings that we have in our electronic health record. So this kind of looks what it looks like in our system. So our hospital system is starting to do social needs screenings on the patients that we have every 365 days. So these are asking them how they're doing with their housing, how are they doing with their transportation, are they social isolated, do they have any issues with housing or accessing care, do they have a primary care doctor, how well are they able to read the pamphlets and stuff that a provider gives them. So we gather all this information, and then at the end, we ask if they want any help with any of this. If they do, they can get connected with one of our community health workers, and we'll help them out. So as of December, we have screened over 76,000 patients since we started our electronic health record in 2021. And then we can find the top needs of our patients. And then another part of community health and well-being is we find this data, we get it, and we try to improve those social needs. So the top three that we have identified is food access, financial insecurity, and social isolation. So those are the top ones that our patients are identifying. So for our first one, food access, we are looking to start a food pantry at one of our clinics so that patients can go and get food. So we're doing different projects within St. Al's and outside of St. Al's. So this data kind of does help us be able to determine what type of projects we want to do throughout the year. And then this one is the Community Resource Directory. The Community Resource Directory is similar as findhelp.org. It's the same thing, it's just a different avenue to enter. And this one is through our electronic health record and through MyChart. So the Community Resource Directory / Find Help Idaho is an online directory that you can find free or reduced cost programs. They can be local, state, or national programs. You can put like on the keyword food and then put the zip code, and it'll find you all the resources within that zip code that have a tag that's food. So we also are partnering with United Way of Treasure Valley, among other organizations like St. Luke's, to provide the Find Help Idaho statewide for all Idahoans. There's a no cost to use that online directory. And then the cool thing about this portal is that it can be translated over to 50 plus languages and can be accessed to anybody in the community. And with our community resource directory, you can actually access it if you have MyChart, so the online portal for our electronic health record. So you can actually access the community resource directory through there. You can also access it through our St. Alphonsus website. And then also you can access it anytime through findhelpidaho.org. And then I just want to plug a little bit of findhelpidaho.org. So they do have training. So if you're interested in how to use the Find Help Idaho, how to claim your program, or how to add your program on here, you can go onto this link, and they do have different trainings, videos, and stuff that you can go on there to be able to learn a little bit more about this program. And then there's a lot of flyers as well on the website of findhelpidaho.org that you can access so that you can provide to community members or anybody that kind of needs the help or support. And then that's all that I have. And again, feel free to email me, message me, call me on my work phone if you have any questions or need any help or have any concerns or have a community member that needs help, and we can get them connected to a community health worker.